So I was involved in two different abstracts being presented at this meeting, which is a collaboration with Janssen Real World Evidence. And kind of the goal of these abstracts was to look at ibrutinib dose reduction and how that affected outcomes for patients in terms of disease control. And both use different types of ways of obtaining real-world evidence. So it's nice to talk about them together because they kind of have the same message, but there's the technique of how that information was gathered is different. It uses time to next treatment as a proxy for progression-free survival in this setting, because when you deal with real-world evidence, it's not possible to pick out when someone actually progresses, like clinical trial patients where they're monitored serially and specifically for this. So it uses time to next treatment, and it's just kind of saying for patients who had a dose reduction of ibrutinib versus those who did not, does this change the time to next treatment? And the answer is really it doesn't. So you don't see a difference in time to next treatment for people who had a dose reduction in their ibrutinib treatment and people who didn't. So this definitely supports using two different real-world evidence databases that this strategy will not, or dose reduction for whatever reason will not decrease the benefit that the patients can expect. So for anyone who is contemplating a dose reduction of ibrutinib for a side effect, it's now, I think, fairly certain you can tell your patient you don't expect their long-term result to be different because you had to do a dose reduction for side effects. I want to be careful because I don't think this supports global dose reduction for everybody. So these are patients, again, in the real world setting, so we don't know all the reasons for dose reduction, but these are patients who likely the vast majority were dose reduced for side effects or some reason. So it doesn't support that we should just reduce everybody's ibrutinib dose after a few months, but it certainly can give people confidence to dose reduce ibrutinib in patients who need that, and that their outcome of the treatment in terms of their disease control should be good. And I really do like the way there's two different kind of methodologic ways to gather this real world evidence that were both reported.